Okay, so should be coming in. Just wanted to do a quick check. This is part two. This is part two of two. The first part was just a few minutes ago, and I am recording this and I am doing this live. If you did like any of the information in that past video, please do remember to like, share, and comment. Let me know what I can add, or if you have any questions regarding this whole topic on health, because it really is simple, and we're going to get into it right now. So this video is going to be for anybody that wants the help with their health. They know that they need dental, or they're afraid of dental. You know, you might be afraid of the bill or afraid of the drill, as they call it, right? So regardless of what category you're in, this video is to educate you and give you some information on, first of all, why it's important to go and why delaying dentistry is deadly. And that's the last thing that we should do. And then the solution about it. So I kind of went over why you shouldn't delay dentistry and why it's important in the first video. And now we're going to go over the solution. And never before has this been possible. I mean, there's a couple of places where you can, of course, see a dentist or see a doctor online, but never in the way that we are doing now. So maybe you've had some dental issues, and instead of driving to the dentist, for the first time, you're actually able to have the dentist come to you, like in your home, in the comfort of your couch or your bed or wherever it is, and not the actual dentist inside your home, because that would be weird. Or not really. I mean, there are mobile visits, but you know what I mean. I don't mean the dentist actually being there, but with your smartphone and with just the camera, you can get your treatment. So they have, the desktop Zoom version, or they have the camera version. But the beautiful thing about dentistry done this way is before you ever talk to a dentist, you can figure out what dentist to even talk to. So that's what MilaK is all about. This is a company that is brand new, and it's for patients, but we're not new, and this is not the first time that we're doing this. So just so you know, we've already been helping. We've already helped over 5,000 patients. I think almost 6,000 patients now. But you can be the next one. Dental is medical, and we help patients like you get help before they go to a dental office, or after they've been to a dental office. Maybe they want a second opinion, or maybe they just want to know if there were other options and if there was a better way. So let's just go ahead and get right into it. We are advocates for your best dental health, and we help you so that way you can get the best doctors. And when I say the best doctors, you don't want to just go to a dental practice or just sign up to see one, because you want to know what kind of dentist you should even go to. There's 12 different specialties, and before I needed dental help, I didn't even know this. I just thought that there was the dentist that I go to. But as you start to have medical need in your mouth, and as you need the dentist more, and as you age, you need to know what dentist or what doctor to go to, because they are different and they do have different training, and they'll help you in different ways. Second is the materials. So we can be advocates for the best materials, but we're not it's not like any one particular company. So when you go to most practices, they only have like one company or two that they work with. We've done the research, and we've looked at them all. So we won't hide a good product from you just because we don't sell it or we don't have it. We'll be happy to educate you on the materials, and especially because this is something that goes inside your body and your mouth, something that we can taste and we have all the time. It's very important that we choose the right materials, not just for the taste and not just for the look, but for how good it is with our body, right? Biointegration is the scientific word, but just how good is it matching with our body, and are we going to reject it later, and is it going to be prone to infection, or is it going to be something that our body accepts? And all of the treatment and financial options, because again, if you end up at a dental office, they're going to sell you on their dentist, right? It's no secret. We all know that. But if you hire somebody that's an advocate, or you ask somebody that's like your best friend in dental, it's going to be a completely different story, right? They can objectively tell you what kind of treatment you need and what are your financial options. But the best thing about our advocates is 99% of dental offices don't know what we know, And the dentists just aren't trained on this. So you really want to go to a patient education or patient advocate expert, because what they're going to do is they're not going to tell you no, or they're not going to tell you to spend your own money or to spend or to get dental insurance. What we're going to tell you is we're going to just simply understand your situation, understand where you are in your dental health, and understand all the options that you have available and make the best call. So that's what we do here for advocates. And we help you get dental help. So there's two main ways that we do this. We have practice locations, of course. So if you want to visit a dentist, absolutely, you can do that. But most people, let's be honest, they're afraid to go to the dentist because of the drill or because of the bill. So we don't want to promote or ask you to come to a dental office if you don't need to go, first of all. And second of all, if you don't want to go, you shouldn't go anywhere that you don't want to go. So what we help you do is to get a custom treatment plan and a professional virtual dental exam from the comfort of your home. You can get dentist approved before you go. And instead of overpaying, it's just $9.99 to get the dentist approval. Literally the lowest cost out there, because there's a lot of dentists at home that would love to help you, but maybe they just aren't clinically fit, or they just want to take a break, or they don't mind giving you a second opinion. So for dentists, it's very easy to look at a treatment plan and to see if it's something that they agree with or not. So we have dentists that can approve you before you go. It's not just patient advocates. We have the whole team. We have doctors, we have lawyers, we have everybody that we're working with to make sure that this is a system that makes sense. And this is a system that you get the best help that you need as a patient. Literally, it's something that does not exist before this. And if it does, I would love to hear it in the comments, because that's what this is all about. Is I would love to help you get your dental without overpaying or paying twice for it. And for the entire industry of dental to be recognized as they should, because they are doctors of the mouth. And so that's what this is all about, is we want you to know before you go, and to have the dentistry delivered to you on demand. I mean, what they don't tell you is that 70% of the exam really is visual anyway. And the x-ray does help them confirm what they already know. But in most cases, without you even opening your mouth, when you've been in dental for some period of time, you can usually find out the people that have, gum disease or infection before they even show you. So it's not a secret. It is something that comes with experience. And so with just some smartphone pictures and camera, you don't even really need to do the whole visit into a dentist. They'll be able to tell you whether you need to come in or not, if it's a good idea, and what your options are. And this way you're not stuck with a surprise, and before you go, basically. So save money is very important, because, like with all of us, money doesn't just grow on trees, and we don't just have it, and if you figure out a way to do that, let me know. Send me a DM, send me a message or an email, because I'd like to know, right? But for all of the people out here that aren't printing money or growing it on trees, it's always good to find a way to save money, or if we find out that we could have paid less for something than we did, I would want to know. So that's what this is all about. Most people do overpay for their dental, and not because they want to overpay for their dental. It's because they simply just don't know what they don't know. And they don't know that medical plans, Medicare, Medi-Cal, Medicaid, that's what we call it here in California, but wherever your state insurance program is, and all of the big ones, they do cover you from head to toe, and your mouth is part of your body. So if you know how to ask for it, they will cover you, so you don't have to pay for it again. So that's what this is about, is saving your money and your time, so you don't run around to 3 different offices and pay $200 or $300 per visit to get an exam. So you can save the time and money by getting the help. This is a model that should have existed. When you go to a hospital, you talk to a triage nurse first, right? They assess you and your needs, and then they send you to the right department. You wouldn't want to end up in surgery and getting opened up if you don't need surgery, right? And vice versa. If you just need an exam, you want to end up there. So that's what this is all about. As dentistry becomes the forefront of healthcare, and we all start to understand that it is the most important part of the body, we're going to need help, or I know I would want help to navigate this, so I don't have to spend 2 years, 3 years, or 4 or 5 years in my case to learn all of this stuff on how to navigate the system and how I could have saved myself, sometimes 10, 20, $30,000 on dental treatment. I didn't even know that it was that expensive, but to replace like your upper mouth, like so your upper arch, it very easily can be 15 to 25 or $30,000 or more. I've seen prices way above that. But so it's not abnormal if you need to replace your whole mouth for it to be $50,000. I mean, goodness, that's like that's a car, a very nice car. But people would be shocked, and most people couldn't pay it out of their own pocket if they were told to. But right now, we have 9 out of 10 people that have Medicare, and they're just simply being told no or denied treatment at their dental office because they're asking for their money, like they're asking for your money, right, in your pocket, rather than just knowing how to take your medical insurance and Medicare. So you can get paid if you just know how to ask your medical plan to do so. And before you even visit the dentist, you can get a check so you can visit any dentist that you want. And we can help you with this. Again, you can visit us at MilaK Live. I just got to admit, I am running out of time on this one. So I guess this will be a video 2 of actually 3 parts. And I'll come back and I'll share with you the solution that we have with MilaK for you to get the help that you need with your dental. If this information was useful to you, if you enjoyed it, if you have any comments or feedback, go ahead and like this. Just share this with anybody that you feel would need the help. And go ahead and comment and let me know. We'll see you on the next video.